Thank you, Mr. Chairman, and thank both of you for being here. Dr. King, I'm going to let you continue on because you hit on the right point, the vertical integration that we're experiencing right now. What you have is you have a PBM who owns a pharmacy. Now the PBM and the pharmacy are talking about buying an insurance company. Now you've got an insurance company, Cigna, talking about buying the PBM, which also owns the pharmacies. The vertical integration and lack of competition is something that, and then they can hide it all throughout that vertical integration. They don't care where they make it as long as they make it. But that's the problem. You hit the nail on the head right there. Anything else you want to add to that?
I just want to pile on. So
Sure.
I think that in some instances we're seeing integration, and it's not just vertical, right? We're seeing horizontal integration, we're seeing vertical integration, and now we're also starting to see cross-market integration, where hospitals are buying provider systems in other parts of states, and in other states. And the more integrated these markets become overall, the less competition we are able to have.
And that's the whole key. Transparency is eminently important, no question about it. But competition is the key as well. And being able to see that competition. I mean, we've used the example about buying a car. I mean, I believe it's New Hampshire who has a database, a website you can go to compare medical costs. That's the kind of thing we're talking about. And that's what's going to lead to decrease in healthcare cost.
Well, that's right. And if there's very little competition in a state, or you have a entity with an extreme amount of market power, they're able to keep prices very high, regardless of how transparent you make them. If you don't have a choice of where to go, they can charge you whatever they
Okay, let me get to my part. First of all, Mr. Chairman, I wanted to ask unanimous consent to submit 2 letters, one from the National Community Pharmacists Association, another from the American Pharmacists Association, for the record.
Without objection, so entered.
Thank you very much. I need to get back very quickly to a question that Representative Barton asked about the coupons being used in Medicare Part D. The anti-kickback, as you know, that will prohibit that from happening. But one thing my colleagues need to keep in mind is that most of these coupons are for brand name drugs, and if you get outside of that formulary, it's going to end up costing taxpayers more. And very quickly, the reason that happens is because when a patient goes and meets their deductible, then goes into the donut, if they increase the cost by buying the ones that are off the formulary, then they get into the catastrophic more quickly, which means that the taxpayers are going to be paying more for their insurance, for that patient's insurance. It's going to end up actually costing taxpayers more. So that's one of the reasons why the Medicare Part D CMS does not allow that to happen in there. So I want to make sure we got that clear. Representative Griffith mentioned my legislation dealing with gag clauses. 22 states have implemented this thus far. We need to implement it at the federal level. Here we are in America with freedom of speech and over 30 years of experience in working in pharmacy, and I could never tell a patient, look, if you pay for this out of your pocket, it only costs you $7, but your copay is going to be $20. And that's just ridiculous for us, particularly here in America, not to be able to do that. I wanted to talk also about PBMs and their licensure and registration. A number of states have required PBMs to register with their insurance commissions, and the most recent one was Arkansas held a special session, and now they've enacted the Arkansas Pharmacy Benefit Licensure Act, where the state insurance department requires PBMs to license within the state. One of the things also, we talk about pharmacies. The number 1 pharmacy in America, CVS, they have more stores. Walgreens, you know what number 3 is? Express Scripts with their mail order pharmacies, yet they do not have to register in each state. Don't you think they should at least have to register in each state? The 3rd largest pharmacy chain in America, and they're nothing but mail order pharmacies? Surely they should have to register in every state. Any comment?
I know very little about it, but it sounds like you're right. Yes.
Okay. I know. So anyway, Dr. King, Medicaid managed care organizations, that's another way that we can attack some of these costs as well, because without having the transparency there to see what exactly the PBMs are charging in those, then we're unable to control cost. In fact, West Virginia just did away with their carved that out and saved $30 million. In Ohio, they saved $227 million. In Kentucky, they figured their cost would be $380 million. Why can't we control that on a federal level as well? We have a number of managed care organization contracts at the federal level. If we could control those, do you think we could have and had transparency in it? Do you think we could save costs there? We could. The answer is yes. I'm sorry.
Gentleman yields back.
Yeah.
Chair will now